If the hospital is having conversations about sending you home too soon and you're not ready, keep in mind that there are departments in the hospital, such as the case manager or the social workers, or even the patient advocates that you can go to and have a conversation with them about what your concerns and fears could be. And be sure to let the staff know what your concerns are. Most of the times when a patient is being forced to go home, it's because they have reached their outlier with the insurance company, to where as the insurance company is not going to be able to reimburse. And the hospital does not want to take that hit to where they'll get stuck with the bill, or the patient gets stuck with the bill, and then they end up having to go into collections. Most hospital staff are trained to properly discharge a patient. They have to document where they're discharging the patient. Are they discharging the patient to a home? Is somebody in the home? Are they discharging the patient to a rehab? Is it assisted living? Is it nursing home? Is it with a family member? Is it to a shelter? They have to document exactly where the patient is going. Now, once they have discharged you to where you have asked to get discharged to, you are home alone and you need help with bathing, maybe combing your hair, getting dressed, getting your breakfast ready, all these ADLs, which are the activities of daily living. Please be sure to follow up with your insurance company. Most of the times you are assigned a caseworker who will be able to assist you, or you can look on the back of your card for member services and reach out to them and just let them know exactly what's going on. A lot of times when a patient has already been discharged from the institution, it's difficult to try to get services once you are already out of that facility. So we encourage the patients to try to get certain services in place before they get discharged. Otherwise, they are starting from the bottom going up. And also having to go to their PCP, which is the primary care physician, could be helpful. The doctor would have to write notes for medical necessities, or there are some forms that they would have to sign, such as the Medicaid forms, or the most recently NIA forms. And those would have to go over to the insurance companies. They would schedule an assessment. And with the assessment, once they do approve, they will let the patient know how many hours they approved for. And they'll be able to get a home care agency who would then send in a caregiver, and or if they have a relative who lives in the building or nearby, they'll be able to have the CDPAP services.